this is what we see when we go for rotavirus. There is so much expense that the government will put into rotavirus diseases. There are for example, in developing countries, 500,000 deaths. And this translates to disability, to loss of income, loss of lives, means loss of productivity. And if you have a country with lots of losses, it translates again to economic disasters, because you will have people dying, and expenses and medical expenses. In fact, we have here from the literature, the total societal costs of $423 million or $19 billion, $19 billion in terms of Philippine pesos for every country that will spend for rotavirus vaccine, for rotavirus diarrhea, for example. And the trend nowadays for countries is to find out if they will be going to an intervention, whether if they spend for this intervention, they will be able to save up on that cost of $19 billion or pesos.
So if you vaccinate early, you can address this virus once and for all. Do you kill it for life, or just for the next 5 years and then you have to immunize again?
Yeah, vaccines are supposed to prevent the disease that you are trying to.
Hindi na bumabalik.
The big burden. If a disease is identified as having a big burden and having a medical cost of billions of pesos.
Kung lalaki din ang gastos mo, unahan na natin ngayon habang mura pa. Preventive na, mas mura pa. At sigurado buhay pa. At ang gastos mas maliit, is what you're saying.
That's right. So health economists are the ones who try to figure out and compute how much the country would put in, what would be the savings, and
may
that's what it's all about.
That's how you figure out vaccination. So tell me, Doctora, why is it, since you brought it to the attention of legislation, why is it today we still don't have rotavirus vaccines being immunized, or the immunization with the kids?
Rotavirus came in only recently. In fact, in America, they have put the rotavirus vaccination only like 3-4 years ago. In Mexico, they have put it much earlier in 2004.
Why is that?
Mexico.
Well,
because Mexico got to realize the advantage of putting it in there. And let me tell you, nowadays we can get figures from Mexico that showed the remarkable, significant savings and the life saved because they have put rotavirus vaccination in their program.
Why is it America was not as vulnerable as Mexico, considering first world versus Mexico?
America has a very kind of very cautious when it comes to
I know. They will spend on nuclear arms and armaments and refuse to put $1 billion. They'll spend $3 trillion on war, but they don't want to put $1 trillion in healthcare. But then again, that's political.
In a way, healthcare system, every country has its own way of dealing with healthcare system.
You've now introduced, as part of your advocacy and bringing up this priority to our legislators. Now, why is it they are not acting fast enough? Or is there progress?
I'm sure there is progress, definitely.
Right.
I'd like to think that our legislators are really responsive to the needs of our people. And just like to tell you that just recently I was at the Senate hearing under the Senate Committee on Health, and I saw a bill that now would put in rotavirus vaccine in our national immunization program. Of course, we all know how bills are. They go a long, long way. But with good advocacy, I mean, if we put all our hearts in this, and I really am passionate about this, because I really feel that diarrhea is one basic illness, and I'd like to show you what diarrhea can do. It's not just the medical cost. You know that diarrhea, as an average diarrhea of rotavirus cost, can make a family spend 8,000. Look at this. An average of 8,000 is spent for 3 to 8 days of hospitalization. That's the minimum wage earner's salary. So this is the cost for a middle-income family. 8,000 to spend for one case of rotavirus that is hospitalized. And in addition, around 1,000 is lost daily from families' income due to missed work, unquantifiable emotional and physical stress. I don't know if you have had a baby. Do you have a kid?
Yes, I have, yes.
A baby,
I know what it's like. It's nerve-wracking.
Who is going to be given an IV. Do you know how emotionally upsetting
Yes,
it is
it
for
is.
a baby to be crying and
Yes.
irritable,
I
and the
relate to
mother
that.
will always say, please, please, make it, give that disease to me, not to my child.
Yeah, yeah.
And yet, it could have been such a simple thing to just give. It's an oral vaccine, by the way, the rotavirus vaccine.
Ito
It's
ba
not even
sakit
injection.
sakit ng mga walang pera, the poor, o sakit din
No,
ng mayaman?
it's a
So, walang
democratic
pinipili
disease.
to.
It's a democratic
Oh
disease.
my gosh.
It can affect all
Lahat
children.
damay.
Even, see, rotavirus is not even affected by clean, hygienic environment.
So how do you get this virus? How do you
It's
get this
everywhere.
virus?
It's everywhere. It's there in your
It's just
table,
there in the table, and
yes, in
if
your
you can just
laptop,
pass it
in
on.
your in your
Okay.
clothes, in the hands of people. But then only the children are so much affected.
Are
That's
we
the big
able
thing.
only to diagnose it today, or it's always been around? Or we've just been able medically to
It was
diagnose
discovered in 1973 in Australia.
Oh, matagal na rin pala.
Yes, and then through the years, they have discovered how severe it is and how it is really getting to be a big burden. And they discovered that all countries are really affected. So through the years, they have started to do the vaccine. And it started to be developed since, I guess, 20 years ago. And for the last 10 years, we've had this available. But it takes time because poor countries like the Philippines cannot avail of such vaccines just like that, because only the rich countries sometimes, only those who can afford, the middle and high income countries
Can we afford
it.
Can we afford it? We spend what, 60 to, I'm not sure anymore if it's 64 billion or 80 billion that we put to healthcare, or to not healthcare, but the Department of Health. Can we afford the vaccination today?
You know, vaccination for all countries should be affordable.
That's
If
what I meant,
only
yeah.
we
Dapat
know,
political will.
let me tell you, low-income countries, what we call Gavi eligible, those with a GNP of less than $1,500 a year
Right.
per person. Actually, these are funded, vaccine funding is being given by the Bill Gates Foundation with donations from 5 rich countries, including England, Russia,
Kasama ba yun
Canada,
sa Bill
Italy.
Gates? Hindi. Sa Bill Gates Foundation.
Bill Gates.
Itong rotavirus na sa Bill
Yes.
Gates. Kasama.
He
So why
wrote
don't
a-
we just introduce it? Why
Our
go through
problem
the
is
legislative mill?
we're not Gavi eligible.
Yeah,
We are not so poor as the other countries.
Okay.
So we do not belong to the
Gee,
countries
that's a new
that
statement.
Bill
That's
and
nice to hear
Melinda
that,
Gates.
yes.
Actually, that's another issue, because although we are not Gavi eligible, our country actually is so much poorer than other countries who are Gavi eligible. You know why?
Why is this?
Because the money, it's an average. It's a per capita income, 1,500. But do you know that 1%, well, I'm sure you know that, actually, the rich, top 1% are the
Maliit
ones
kasi ang pyramid
that
natin.
putting-
It's a social
that's
pyramid.
right.
Yes.
The ones that are putting
It's
our
very
GNP
difficult.
down.
Yes, it's very difficult to get an average. It's a false
But our
reading.
poverty index is so much higher. That's why in the Philippines there's a great inequity. The poor is so poor, the rich is so rich. And the average actually somehow
Are getting
does
squeezed
not-
out from both sides.
Yeah. and actually, I've been involved in this kind of program now. I'm being interviewed as far as what we can do for our kind of country, low middle income. We're called low middle
Low
income.
middle income.
To try and get vaccine funding also available. Because, see, the Gavi eligible are being helped by Bill and Melinda Gates. The rich country are being helped by their own economic gains. And how about the middle income countries? How are we going to afford this vaccine? And that comes to your point. Can we afford the vaccine? My thinking is, if we are able to leverage with vaccine manufacturers to bring down the price, just as Gavi eligible countries are getting it, we may be able to afford it. But the key
isn't that a
is
big
to
problem right now in the country? I mean, we have this issue, the the Medicine Act, which came out last year. It was heavily contested. It was a very hot issue. I remember it was Congressman Locsin who was fighting it out with the pharmaceuticals, and Biron, the doctor in Congress, they're fighting this out. And as it turns out, even Senator, what's his name, Rojas, who ran for vice president.
Right.
Diba? Ang Medicine
Yeah,
Act.
and it was passed.
It was passed, but
into
only
law.
for 20 specific life-threatening medications, but not across the board where they would drop the price, because cost of medicine in India